First up is Daniel Freiheit, online. 5 minutes, go ahead.
There we go. Thank you very much. And thank you for not abridging it to 3 minutes. I was worried when you guys were late for quorum earlier. I thought there was going to be no shows due to the traffic. But catch me at the infrastructure committee, because I think traffic is also an interesting health issue. And it shows an interesting relationship between the mayor and there's something called the Global Covenant of Mayors that impacts the city that I don't think people are aware of. Just by way of a background to the new medical officer of health, my name is Daniel Freiheit. I operate a Twitter account called Lion Advocacy. I've been doing a lot of advocacy on X about vaccine mandates in regards to COVID. But the information and the intelligence I've learned from that experience has applied now to beyond COVID to some of the issues that the city is now experiencing with low vaccination rates, although increasing, with the 60,000 kids that apparently aren't staying up to date. The 60,000 kids that aren't up to date on their vaccines, I think is connected to a lot of distrust that I've been highlighting with public health over the past few years. This board in particular, the former medical officer of health, and I want to make sure the current medical officer of health, and I guess I'll direct my comments to the new medical officer of health, because I find when I speak to everybody, I speak to nobody. So I'll consider this a direct address through the chair, of course. Dr. Paul Offit, who is a former FDA Vaccine Advisory Committee member, and Dr. Sanjay Gupta from CNN, he's the one that is the public-facing vaccine expert for CNN. Both have now acknowledged miscommunication failures with the COVID vaccine. Dr. Offit saying it was oversold. The vaccine was oversold in terms of efficacy, which I consider basically misrepresentation, which induced people to get a vaccine that they probably didn't want to get. There was also a misrepresentation acknowledged with regards to natural immunity from Dr. Sanjay Gupta. So with the backdrop of these kind of oversights with the COVID vaccine, I wanted to address the current policy of the medical officer of health to suspend children from school. Suspend kids from school for 20 days for not getting vaccinated with the 3. There's only 3, by the way. There's only 3 listed in the schedule, and those are, you can check them in the law. It's a meningococcal disease, pertussis, and varicella. Medical officer self sends out a direction to the principal to suspend kids for not getting those vaccines. And the language in the report that the medical officer of health is that the school is now trying to prioritize reducing the number of students that are suspended from school for non-compliance with the ISPA. This is not correct. This is not accurate, okay? There's no requirement to suspend kids for not getting vaccinated for these 3 diseases. And by the way, Quebec doesn't do this. An entire province with tens, hundreds of thousands of kids does not do this. The kids are doing fine. Here's what the problem with suspending kids from school does, okay? It creates a bit of a coercion, especially for the holdouts that really don't want to get vaccinated and may just do it because they're isolated, and then their free consent isn't really given. There's no requirement to suspend these kids, okay? It's permissive language in the legislation. Check it. It says the medical officer of health may ask the principal to suspend. This language and this dicey responsibility ends up passing the buck from the principal back to the Minister of Health, where everyone's saying that they have to suspend kids. They don't. It's not true. You don't have to suspend them. If they're contagious, maybe consider putting some restrictions on them coming to school. Suspending kids from school for not taking childhood vaccines is not a requirement, and suggesting that it is passes the buck of responsibility. Mr. Brown and Mr. Latouche use incredible language, which I fully support, which is that you want to create a loved and caring environment, an environment of belonging and trust. That was Mr. Brown that said that. Safe and accepting were the words I heard used from Mr. Latouche. Excellent words. Suspending kids from school, not cool. Don't do it just so they can take the medication. Also, another message for the minister for the chief medical officer of health. You encourage people to get over the age of 6 months to get the flu and the COVID vaccines, not according to the National Advisory Committee on Immunization. They do not share your view on that. So why is there a departure? The language from NACI clearly says that the people may receive. It doesn't encourage anyone. And so what I've noticed during COVID, and I've gotten intelligence from X, is that people we're passing the buck on responsibility. Oh, we're complying with public health requirements or or advice from public health. Careful. They're getting those 2 vaccines at once. There's a dispute on that, whether that's the best way to do it. Encouraging people, let the physicians, let the family doctors encourage that. They probably won't. Thanks again. And follow me on Twitter, by the way, everyone, because I think
Thank you. You're at time.
learn
Thank
some
you.
stuff.
Any
That was
questions?